Hi, my name is Kim Scanlon. I'm a speech language pathologist, and today I will be talking about how to be a more responsive communicator. And I want to thank Becky from the SLT Scrapbook for inviting me back to this EI event. I participated last year, and I'm so happy to be back. Okay, so let's get started. So, as I said, I'm Kim Scanlon. I'm a speech language pathologist. I've been practicing since 2007, and I have worked in every setting. Now I have my own little private practice in northern New Jersey, and I've written 2 books on toddler language development, My Toddler Talks and My Toddler's First Words, and I have 2 little children. Okay, so today, as I said, I'll be talking about responsiveness and how to become a more responsive communicator. So the first thing I want to start with is, how does it make you feel when you are speaking to someone who doesn't seem interested in what you have to say? How does it make you feel? If you're talking to someone and they're not giving you any acknowledgments or encouragement to keep talking, usually you stop talking, right? Now, what happens if you're talking to someone and they are interested in what you have to say? That you can tell that they're listening because they're looking at you, they're giving you, their facial expressions are indicating that they want you to keep talking. They may ask you some follow-up questions. And when that happens, we usually keep talking, right? And we have some back and forth communication if we're good communicators too. So people are just naturally better at being responsive, engaged communicators. And other people have to be trained or taught, or they need to learn how to become better communicators. Sometimes it's not easy, and but we can learn how to become better at anything as long as we're motivated and if we have good resources to teach us. So, as speech language pathologists, it is extremely important for us, especially for us if we're working in early intervention, to appropriately train parents and caregivers on how to become more responsive communicators with their children. So, what exactly is responsiveness? What does it mean to be responsive? I went to 3 different resources to pull up 3 different definitions of responsiveness. The first one is from Rubble, McDuffie, and King and Lawrence, and they define parent responsiveness as parents' effectively positive and contingent reactions to children's acts of play and communication. Flippen and Watson define parent verbal responsiveness as parents' use of responsive language input that follows the child's lead and maps to the child's focus of attention. The third definition is from my book, From My Toddler's First Words. In that book, I share many different techniques, and one is called Be Responsive. So I refer to being responsive as quickly responding to our child's focus of attention and any of her attempts to communicate. These communication attempts may be verbal, so a word or a word attempt, or nonverbal, a gesture or a gaze. So what exactly do these definitions mean? It means that responsiveness are reactions or verbal responses, so what we say, in response to the child's interests, their actions, what they're doing, communication, what they're saying, communication attempts, so if they're just saying ga, 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 boo, 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 boo. And our responses are positive. They are related to what the child is doing or seeing, and our responses are provided quickly. Why should we be responsive communicators? The research is extremely rich in showing that there is a positive association between a parent's responsiveness, parental responsiveness, and child language skills. Okay? So, a lot of this well documented, numerous research indicates that teaching parents how to respond to their baby or their child's nonverbal and verbal um, actions and interests stimulates language development. And this is true for typically developing children and then children who are at risk for language delays. What we know is that when the responsiveness begins early, when it begins at birth, children begin to understand that they get a reaction. If a baby cries and their caregiver comes over and they respond, they will get their needs met. Okay, so it starts with getting their needs met. And then it starts to evolve into like this dance, this back and forth communication, that social interaction. So the more a parent responds to a coo or a grunt or a fart or something cute that babies do, the more they're going to want to do it if they're getting a good feedback from the parent and they have good, that good attention to what their parents or their caregivers. Please know that when I say parent, I want to be inclusive, and a lot of the research that has been done refers to parental responsiveness and parent responsiveness, mother responsiveness. There are some studies about fathers, and that we don't have time for that right now, but it's very interesting. So when we have a baby and we're starting to do peekaboo with them, we're not doing peekaboo necessarily to get them to say boo. We're doing peekaboo because they're engaged and they're smiling and they're cooing and they're laughing and they're reacting to what you're doing. So it's like a mutually responsive kind of situation that encourages that back and forth. So then as a result, the child then starts to have more vocalizations, have more gesturing, and that all promotes those pre-linguistic language skills, right? Vocalizations, gestures, eye gaze, attention, babbling. And then that helps to promote first words. And then we have more first words that promotes word combinations. And from word combinations, more vocabulary. And then it even goes up to showing that that parental responsiveness helps to develop language that talks about past events. So there's a lot to it about why we should be responsive. How do we give good responses? Responses that are going to encourage language development. So based on those definitions of responsiveness, I teased out what researchers have found. Okay, and I'm trying to make this very parent friendly. So it means that we want to train parents to give responses that are immediate, that are contingent, and that are individualized for the child. Okay, so when we say immediate, we want the responses to occur within a few seconds from what the child has said, has tried to say, is looking at, is playing with, or is touching. Okay, and if autism is suspected, research has supported that you want to give the response within 3 seconds so they can easily map it and understand it. So contingent. When we say contingent, it means that we want to make sure that we are giving a response that is related to what the child is doing. And I will elaborate on that in the examples that are going to be coming. Now, individualized. This is really important. We want to modify our response based on the child's developmental needs and the child's current language abilities. So when we do all these and we make all the responses immediate, when we provide responses that are immediate, contingent, and are individualized, they're much more meaningful to the child, and there's going to be a much better increased chance that they're going to understand what you're saying. Okay. So within this larger picture of responsiveness, there are strategies that we use in our field as speech language pathologists, working with toddlers and children who are acquiring language, that we have in our toolbox, right? And some of us may not even know this, but a lot of what we do and what we're trained in they are techniques that encourage responsiveness. So, following the child's lead, that is a responsiveness technique. Waiting for the child to initiate conversation, that waiting expectantly, that's a more passive um, responsiveness technique because you're not saying anything, but you're still waiting for them to maybe initiate or say something. And it's very effective and it's very powerful. Um, Being at the child's level, so being face to face, not demanding eye contact. It's not the same thing. Please don't ever think that when you're face to face, some kids don't even like face to face, so you may have to be side to side, but you're at their level, okay? That is a responsive technique. Those techniques are child oriented, so they are used to complement or to comment on what the child is doing, right? So they're child led. And then join in the play. That's a really great one too. There are techniques that encourage like more back and forth communication, that social interaction component. I mean, so do the child-oriented responses too, but when a child may have a little bit more language, as we know, the responsiveness techniques are individualized to the child. So you can still be using these techniques, preschoolers, school age. You even use them now as adults. Of course, you just modify them. So what we have is when we ask a variety of questions to preschoolers or to kids who have more language, we encourage turn taking. We build turn taking into playing games, into play routines. We're doing that to keep it going back and forth. And then there are responses where we are modeling the language that we want them to use or to try to use. So we may imitate them. That's a great one for the kids who are just starting out with using first words or actions too. And then we start using a variety of different words with them. And then we have the expansions and the extensions. That's a big term that we like to use in speech therapy, where we expand, where we add more meaningful content to what they're saying. And we make some of the content, what they're saying, grammatically correct. Okay, so we're expanding on what they say, and then we're extending it by adding in new content that is related to what they're saying. So those are the responsiveness techniques that most of us use as speech therapists, and we may not even know that they're really part of like being a more responsive communicator. And remember, we're doing this not to put the pressure on the kids to communicate. We're doing this because it helps facilitate a more meaningful, joyful interaction with the child. Okay, so I really wanted to talk too about some of the barriers to being a responsive communicator, because you may be listening to this thinking like, oh yeah, this is like totally makes sense. But as I said earlier in the presentation, some of us are better at being responsive than others. So as speech therapists who may work with young children, particularly their families in the early intervention system, we have to be very mindful to be aware of what kind of situation we're walking into. Are we walking into a family where the baby was born very prematurely, and the caregivers for a while were scared to pick up their baby because they were scared of hurting the baby? Because this is what happens sometimes. And so as a result, maybe the baby hasn't gotten as much hasn't had as much interaction or parental responsiveness as it may have needed. Now, what we know is a lot of times parents feel overwhelmed if they have a child who has a delay, or if they're at risk for having a delay. And when you feel overwhelmed or stressed or you're tired, you may not be as responsive as you need to be. Okay? And they unintentionally, it's unintentional. If you're unintentionally disengage from being responsive to their baby or their toddler or their child. So as a profession, we have to really make sure we keep an eye out for that. Mental health is a huge concern right now. Considering we're in a pandemic, hopefully coming out of the pandemic soon. So there is some fatigue, lack of motivation, stress, and depression that could affect being responsiveness. And then another times, like what happens is if you're trying to be the responsive parent or the responsive caregiver, you may not be getting a response from your child. And so a lot of times if you're not getting a response, like I said in the beginning of the session, if you're talking to someone and they're not like giving you anything back, sometimes you stop responding. Sometimes you stop giving responses. The children who need it the most get it the least. And so our job when we go into an environment isn't to force our parents um, to use these techniques. It's for us to be aware of, okay, well, what's happening in this family? How can we talk to the family and see like what they're doing and how they're thinking? I mean, that's all about what early intervention is now, is the parent coaching and empowering the parent. Okay, so but these are just things, especially if you're a new clinician or if you're new to early intervention, sometimes it's mindful to keep an open dialogue with parents and to just observe parental responsiveness in general. Another thing is you may not be responsive because you just may not know. You may just not know like what exactly I have to do. For instance, I work with a lot of parents all throughout the week, and well-meaning, well-intentioned parents, highly educated parents who may not know what to do when their child does something. For instance, I had a parent ask me, well, when he says and I know he knows the word for that, what he was saying it for, or he just says he defaults to all the time, like, what do I do? And so we talked about that, and it's important to still be responsive to those utterances like that. Like if he's pointing to something and he's saying don't just ignore it. Like that kid is trying to tell you something and communicate something to you. So it's important to be responsive to that. Sometimes parents have a hard time knowing what to do when they may not understand what the child wants, what the child's intentions are. Maybe the intentions aren't clear, and there's ambiguity. So what we know in responsiveness is it's a lot easier to respond to something when we know the context. So it's easier for us to be responsive if the child is touching or playing with something versus if the child is looking at something or sometimes even pointing to something far away. So it's that ambiguity that can sometimes make it hard to be responsive. Another thing I want to address here is that some of these responsiveness techniques may not be culturally appropriate for certain families. So when you're in another person's home, it's always a good idea to talk to them about the strategies, what works for them, and what respects their culture and respects their values. Okay, because in some families, in some cultures, there's less of an emphasis on the child-led oriented responses. Now I will share examples of 3 different responsiveness strategies. The first example here is one that is a child-oriented response, and it consists of following the child's lead. So the child is looking out the window and he sees some birds. The mother responds to the child's focus of attention by looking at the birds and even imitating the child by pointing in unison. Okay, so in this next slide, we're going to talk about interaction promoting responses. So interaction promoting responses are ones that encourage some social reciprocity. So they encourage going back and forth. They encourage extended conversations. And a lot of times we can do that through play. My turn, your turn. You do something fun, the child wants you to continue to do it. So you do something fun, you wait, the child gives you a response, and you continue. In this last example, we have a child who says Bubba while pointing to the bubbles. So the parent or the caregiver then models the correct response, says bubbles, and presumably gives the bubbles to the child. They are face to face, the child, or they're side by side, but the child can see this adult. The adult is waiting expectantly for perhaps maybe another response from the child, an acknowledgement that he wants the bubbles. And remember, all of these responses are individualized to the needs of the child. So if the child was to say me bubbles, the adult can expand it by saying you want the bubbles. The adult can also extend it if they want to add some more content, new content to what the child is saying. The adult would say, you want the bubbles. You want to blow the bubbles. This concludes my presentation. Thank you so much for listening, and thank you for having me. You can find my books on Amazon, and you can visit me at mytoddlertalks.com. I have an awesome free resource library. Please subscribe. And you can also visit me at scanlonspeech.com. I have 2 different websites. My Toddler Talks is dedicated entirely to toddler language development, and Scanlon Speech is a mix of different language and speech therapy resources. Thanks again.